World No Tobacco Day is observed around the world every year on May 31st. It is meant to encourage a 24-hour period of abstinence from all forms of tobacco consumption across the globe. Consumption of tobacco in any form is injurious to health. So, if you truly value your life, say a no to tobacco, since it leads to death. An interview with the renowned world cardiac specialist, Dr. P.K. Das, shall enlighten you more with the side effects of tobacco consumption. Hello and welcome to our special show on Anti-Tobacco Day today. In conversation with me over here today is a very renowned MBBS, MD, Internal Medicine and DM, Medical Oncology, Dr. P.K. Das. Welcome to the show, sir.
Hello.
Well, it's almost been 13 years since you've been practicing as a senior consultant medical oncologist with Apollo since 1999. So how has the experience been so far practicing in cancer, obviously specializing in it, and treating patients also of a disease that almost any and every person, when he or she hears the name of, gets afraid of, which is cancer?
Cancer by name itself is a very, very dreaded word itself. Whenever a family or a person come with a cancer, they are almost devastated. So we have to see the psyche of the family, of the patient. Sometimes the family persons and members, they are coming with the diagnosis and they don't want to disclose the diagnosis to the patient. So we generally avoid that word cancer.
Right.
So we try to make the patient as comfortable as possible. We call the patient, make him sit comfortable, make him comfortable and just hear patiently regarding his problems, and always they are in a very, very great distress and a panic kind of a situation. So we just avoid that word cancer, and you just tell, suppose there is a cancer in the lung, we see, we can presume, we just tell there is a small tumor in the lung, so we can tackle and we can handle it. The days are now better now, and really there is a huge advances. Not to worry, and even if there is disease is there, whatever the stage, we can make this disease chronic. We can treat.
So as you've said that this is no more, the disease cancer is no more chronic disease. It's no more a killer disease, rather. It can be made into a chronic disease with proper treatment over a period of time. But yet as an individual, any person who hears the name today of cancer gets afraid on the first turn, on the first chance. So what is cancer, if you were to tell our viewers today, what exactly is cancer and how is it caused?
Yes. See, the cancer, we want to spread this message, so there should not be any panic kind of a situation. And the cancer by a word itself, and this means abnormal growth of a cell can cause unregulated, unproliferated growth of a cell or a tissue, can give rise to a tumor and land up with cancer. This, we can have 100 type of cancer in our body. In the nail and hair, they are only spared. Each and every organ of our body can have cancer. Okay. So the depends upon the site. Suppose you are smoking a lot, so you can have lung cancer.
Yes.
You are eating a lot of tobacco, chewing tobacco or the gutkhas, pan masala, you can get mouth cancer. It's all site specific.
Right.
See, we are eating or a lot of junk foods, all this having the chemicals or these adulterants and everything, and along with a lot of alcohols and all. So you are going to get cancer in the intestine, in the bowels, in the stomach, in the pancreas, in the kidney and the food pipe. Yes. So all this cancer depends upon the type of carcinogens we are getting, whether you are getting through the food or in the water or the vegetable, excess usage of pesticides and all, and over the years they are getting accumulated in our system, and you can get this cancer.
Yes, so if you basically see, cancer can be caused by exposure to any wrong kind of usage or consumption that goes into our body, be it water or be it any other exposure that we're exposed to, which our body may not be comfortable adapting to and can be dangerous or harmful to our body somewhere.
Right.
But over a period of time, if you see, there has obviously been an increase in cancer over the period of years that we've seen. Why do you think this has happened of late?
See, average survival of an Indian population in 70s, it was around 45 years. And now in 91, the average survival become 62. Now we are predicting in 2000, this decade, the average Indian population, they survive, they can 70 plus. How this happened? This becomes, we have achieved a very good control over the infectious disease. Hardly these days any person is getting died because of tuberculosis, malaria, typhoid, cholera, all these infectious, we have a very good control. But lifestyle is a major problem. So because of our lifestyle, because of the urbanization, industrialization, pollution, and the kind of a stressful lifestyle, junk food, everything has, all these cancers are man-made. 85% or almost 90% of our cancers is because of the lifestyle now. And next to the major killer like cardiovascular diseases, blood pressure, diabetes and heart disease, major killer is the cancer. So this is a global problem. It's a problem of not only the developing world, it's the developed world everywhere. But in our country or in the developing world, the majority of the cancer we see in advanced stage. That's unfortunate. We see more on stage 3 and 4.
Yes, definitely. And as you've said right now, that the kind of urbanization has led to today that we are living in the world, and also at the same time, given the fact that somewhere we are educated masses living a very fast life in this hectic world today. So that obviously has led to a change in the lifestyle, which has seen that the usage of alcohol, smoking and tobacco has also increased considerably over the period of years. How much do you think tobacco specifically contributes towards getting or developing cancer in an individual?
Any form of tobacco is harmful. So now the tobacco consumption, the pattern has changed. From over the decade back, it was like bidi, then cigarettes, now this gutka and pan masala, the habit is changing. So any form of tobacco consumption, they are bad. They are getting accumulated over the years. Like for example, see you are eating this khaini or gutka or the pan masala, how they cause cancer. So because of the continuous usage of the gutkas and all, they keep in a particular area in the mouth. So while they eat gutkas and pan masala, they contain all of carcinogens like arsenic, nicotine and so many poisonous substance, and keeping in particular area, they irritate that area.
Yes.
So while you see the decade back, our practice like eating pan. Pan people are eating in the generation. They are eating pan, but pan, what happens, they don't keep in particular area. The pan get absorbed into the system and get, so the consumption, we don't advocate for the pan eating, but definitely the gutka and pan masala is bad. They continuously irritate particular area of the mouth. If you don't stop, what happens, because of the irritation of the cell changes the identity. You see a white color spot, we call it a leukoplakia. That is a pre-cancerous stage. It's a totally preventable. If you stop this gutkas and khaini, then it can be converted back into the non-cancerous stage. If you continue using, that white patch become a red patch. That is the next stage. And for the red patch, we call it a erythroplakia, then develop the tumor stage. That is a malignancy. That is the cancer. So everything, any kind of irritation, continuous irritation to a particular cell will become mutated and will get cancer.
That will actually lead to the death of the person ultimately. But if you have a look at the way the consumption of tobacco has increased in the youngsters specifically, the majority increase in the consumption of tobacco has been in the youngsters of late. Why do you think this has happened, and what steps could be taken to reduce the consumption amongst the youngsters of tobacco?
Few years back when cigarettes came, so that was a fad in the society, but a kind of a status symbol. People are using either cigar, then pipes and the cigarettes and all. So now, and these days, in the public places, you can't smoke. There is a restriction. In the school or colleges or in the public places, in the hospital or in the airports or the offices, hardly you can smoke. But to carry a pouch of this pan masala, tobacco or gutkas and all, very easy. There is no restriction. There is no legal problem. So you can eat anywhere. Right. So you can eat this gutkas. That's why in the last 2 decades, the consumption of this gutkas has increased, particularly in our country. We are the leaders in the mouth cancer.
Yes, which is actually shocking and very sad. And somewhere do you think that the solution to this problem could be at the grassroots level, like providing education or having promotional ad campaigns and putting restrictive banners or restrictive situations in schools and colleges, especially for the kids, because kids are the ones who are most prone to developing these activities, because children are the people who pick on habits from what they see in their surroundings, and picking on a bad habit is very easy for them. So do you think somewhere the solution to this problem lies at the grassroots level for us?
See, the grassroots level in the particularly our young generation, the kids and students in the school and colleges. So, and because of the taste, because of the peer, the friends and all, they are eating and getting a kick out of this kind of a tobacco and nicotines. So that they are addicted to this.
Yes.
So we should have there is a lot of efforts are going on. So now, but the huge, many things has to be done. So as you said, so many things, like the people are avoiding selling all this kind of pan masala gutkhas in the school or colleges premises, and we should have a lot of awareness campaign, and we should show what are the side effects of this gutkhas or this tobaccos in any form, how they are dreaded, and most of the time because of this, how we are losing our valuable lives. Because of this, once this cancer is become advanced, and they will losing the person.
Yes, so there will be no cure to the treatment.
No cure to the treatment. So this is basically a totally preventable thing. Yes. We can stop eating, then we can avoid this cancer.
Yes, and one of the other things also, doctor, that we have seen contributes to cancer apart from tobacco is obviously smoking. It's very injurious to health. We have every ad, every feature film or anywhere where we see on television or in public, we even have smoking, it's said over there, a clear banner would say smoking is injurious for health. But yet people are smoking. At the same time, one of the other partners of smoking is called passive smoking. Could you please tell our viewers first of all what is passive smoking and how injurious can this be to the development of cancer within an individual?
See, the growing kids and the family member, like the ladies at home, they are more susceptible to the passive smoking, because the person, the male member or the head of the family, if he smokes at home, he is getting affected by the smoking, as well as this passive smoking can affect the kids as well as the family members. The smoking not only cause the different kind of cancers, it can cause other ailments also. So because of the passive smoking also, people can get allergic bronchitis, asthma, chronic obstructive airway diseases, or the coronary artery disease, and along with the so-called dreaded cancers. Yes. And suppose the kids affected by this passive smoking, there is a developmental problem. The growth and the brain and their vital organs can be affected.
Apart from smoking and tobacco, alcohol also to a certain percentage does contribute towards cancer.
Absolutely, yes.
What would you like to say towards the people who are chronic alcohol drinkers somewhere and they're regular alcohol drinkers, chain drinkers for that matter? Do you think they're actually harming their own lives by drinking alcohol on a regular basis?
Alcohol, definitely most of the time people consume alcohol along with the smoking also. They eat a lot of junk foods along with the alcohol and the smoking. There is a synergistic effect. Alcohol along with the smoking increase the risk of different kind of cancers. So continuous consumption of the heavy amount of alcohol can lead to cancer in the liver, kidney, pancreas, intestine, all the food pipe, stomach. So the cancer, because of the, not only because of the only alcohol, and you are eating a lot of non-vegetarian stuff, all this tandoor and kind of grilled stuff of non-veg fatty foods, that also again increases risk along with the alcohol. Yes. That should be avoided. Alcohol in moderation, people generally they advocate in moderation is acceptable, but avoid excess drinking.
Doctor, since you just now said that cancer is no more a killer disease, rather it can be made into a chronic disease with the right kind of treatment over a period of time. Yet somewhere, every individual who has cancer today, when he or she hears the name of cancer, first of all, freaks out. The first instant reaction is that they tend to get afraid and worked up and nervous because it is cancer at the end of the day. So for the audience, what would you like to tell them that what exactly is cancer and how is it caused?
The cancer, because of our bad habit, majority of the cancer is man-made. Almost 85 to 90% of the cancer we see, this is because of our lifestyle and the bad habit. So you think of any kind of like alcohol consumption, cigarette smoking, chewing tobacco, eating gutkhas and all over the years, they can irritate the cells.
Yes.
Because of this irritation of the cells can cause abnormal mutation in the cell, and there is an uncontrolled, unproliferated growth of the cell can lead to the tumorous growth or a cancer. So over the period in the years you see in India and the last decade or so, there is a huge number of gutkha manufacturing units.
Yes.
So if you see around 50 to 60 registered units are available for the cigarette manufacturer, as well as you see in this gutkha manufacturer almost touching 1000. We are the world leader in manufacturing gutkhas and all. And this part of the world, we are the highest incidence of mouth cancer. So this is because this scenario is changing, and people are possibly because there is a restriction of smoking at public places, and to carry a pouch of gutka or pan masala is very easy and to consume in different places. That's why probably the numbers and all are increasing, and the site specific the cancer can happen. Though like I said, continuous usage of the gutkas can cause mouth cancer, continuous usage of cigarette smoking and all can cause lung cancer, excess usage of this alcohol and all can cause cancer in the intestine, food pipe, stomach, and the liver and pancreas. So depends upon the site get affected by the carcinogens. Like the food we are eating or the water we are drinking, they're full of pesticides.
Right.
So over the years, what is happening now? People are not dying of infection. They are surviving for years. So the average survival, suppose, are increased to 70s now. Majority we are seeing in families that persons are surviving 70s, 80s, late 90s. You see what is happening. All these carcinogens are getting accumulating in your system over the years. So because of the carcinogens are irritating over the years, the cells can change in their pattern and they can convert into cancers.
This is said and done that at the end of the day, a man himself or herself is responsible if he or she develops cancer because of his lifestyle and eating habits. But do you think that somewhere even the environment and our surroundings also indirectly contribute towards the development of cancer in an individual?
See the individual, if you see, I'll see the example of a breast cancer. So the breast cancer is a common problem in the ladies in our country or globally also. So we don't see in the villages the incidence of breast cancer. Delhi NCR, we are the highest. The incidence of breast cancer, Delhi NCR is the highest. Next is Mumbai. Why? The urban areas we are seeing the incidence of breast cancer is increasing rather than the villages. So if you go to US, they are getting 1 out of every 8 female is getting breast cancer. In UK, 1 out of 12. According to the ICMR, they are predicting around 1 out of 20 is getting breast cancer in Delhi NCR. If you see the Indian population, 1 out of 20 is huge in our country perspective. So why this is happening? If you see the urban and the rural, the lifestyle, because of the career and ambition, ladies are getting married at late age because of the career and all. Late age means and getting married after the age of 30, first childbirth after the age of 35, no breastfeeding, junk food, smoking, alcohol, and stressful lifestyle, and usage of oral contraceptive pills, all the hormone replacement therapy for a prolonged period, and all this is prevalent in the urban areas. Go to villages, what is happening? They're getting married at early age, and they're getting a lot of kids, and breastfeeding goes on and on. They do a lot of physical activities, hardly they get any junk foods.
Right.
So they are protected from the breast cancer.
Yes, they're basically leading a much more healthier lifestyle as compared to the kind of lifestyle that we today are leading. But one of the major factors that we've seen of late, and that's you've also said over here, that India is a nation which is highest in terms of cancer today. The proportion of cancer, or should we say the percentage of cancer that exists in our country is much more as compared to the other countries. What do you think is one of the major reasons that has contributed towards this being today?
So basically the rapid industrialization and this economy and the developing country. So we are following the Western, and always our young generation as a part of a fad, they're smoking a lot, and they hardly any physical activities, sitting at home, no external activity, physical activity, exercise are going down and down. You see the lot of obesity, our younger kids and all, junk foods, lifestyle is changing now. So the incidence of cancer is increasing day by day in our country. So the kind of the socioeconomic condition also, and repeated, if you go to the villages, all these lower socioeconomic group, they are living in an area there where we are getting a lot of recurrent viral infections.
Yes.
So because of the infections also, some of the cancer like cancer cervix in female, recurrent human papilloma virus, unhygienic living condition, unhygienic sexual practices, and they get a lot of cancers. So the developing world in our country, the incidence of cancer is rising.
Is rising high, very, very high in fact. And talking about the way the Indian population is distributed, approximately 75% of our population today is rural and only 25% is urban. In that 25% population also, the majority of the population, which is actually kids, they are leading towards and developing obesity, which is one of the major concerns of almost every doctor today and every individual. How much do you think obesity can actually contribute towards the development or a child becoming prone towards developing cancer in the later stages of life?
See, all these junk foods which we are talking of, these junk foods, and recently also we have seen in the newspaper and print media, and all adulteration in everywhere, all these foods and every grocery items and anything you purchase, whether it's the fruits or vegetables or the grocery item, all this addition of the colors, all the flavors and everything, in due course of time they are getting accumulated in our system. Yes. And we call them as carcinogens. Yes. These abnormal chemicals are getting accumulated over the years. Particularly the kids are very prone because they are eating all these junk foods. There are hardly any physical activities, going outside, not playing, sitting at home, eating junk food, and this obesity can lead to other associated problems like cholesterol problem, coronary artery disease, blood pressure, and this can lead to other associated ailments leading to cancer also.
Ultimately. So overall, if we have a look at what we have discussed today, at the end of the day, a healthy lifestyle is the key to a healthy living. That is what you need to adapt somewhere in your body, is what our doctor over here, Dr. P.K. Das, has told us today. Thank you so much, doctor, for coming over here for the discussion with us today. It was indeed a pleasure having you here.
Thank you.